so I'm doing the IV push medication administration, and we're going to be giving Zofran at 4 milligrams. So I would walk in, introduce myself, explain the procedure, wash my hands, make sure I close the door. I would want to ask them if they have any allergies to the medication. I would want to see what's currently infusing and whether it's compatible with our medication. I would want to make sure that the IV site is patent, so we don't see any infiltration or any inflammation. It's not hot. There's no redness around that. So I'm going to start off. So getting my medication ready. So I don't have my primary IV bag or primary tubing, so I'm going to just verbalize a lot of what I'll do. Okay, so I'm going to go ahead. I'm going to open up my alcohol pads, and I'm going to wipe down the top, and I'm going to take my syringe, and I'm going to pull up 1 milliliter of air. And I know I said we were giving 4 milliliters, but we're only going to give 1 milliliter. So I'm going to put air into that, and I'm going to go ahead, take it out of the vial, make sure I don't have any air bubbles in my syringe. Okay, and then I'm going to recap that. Alright, so I've also got my saline flush, and I want to make sure that I take off the cap on my primary IV, and I'm going to choose the connector that's closest to the patient, and I'm just going to wipe off the top and take off my sterile cap, and I'm just going to wipe off my my flush just to make sure everything's clean. And I would inject 2 milliliters of my saline, and I'll recap it to make sure that's sterile. And then I'm going to go ahead and push my medication, and for the Zofran, we're going to push it for 30 seconds, but it's preferably 2 to 5 minutes, so I would just put that in there. And then I'm going to flush at the same rate as we pushed our medication, so I would put 1 milliliter, flush with 1 milliliter of my saline, and then I'm just going to wipe it down again, and I'm going to recap it and make sure everything is unclamped on my tubing. Make sure that make sure my pump rate is good, and then I'm going to document using correct format, the day and time of the procedure, and whatever the policy wants us to document.